It doesn't look on today's numbers like the Western Cape is over its peak yet, but what can you tell us looking at the averages?
Very good evening, Sally, and good evening to all of the viewers. The epidemic in this particular third wave is proving to be slightly different from what we've seen in the first and second waves. I think when we looked at the second wave, the decline in the epidemic was quite rapid because there was greater synchrony between the provinces. With the Delta variant, because of its rapid spread and the way in which it has spread, compounded by some of the disruptions that we've had in parts of the country, we seem to have the provinces somewhat staggered. So when you look at the national data, we look like we're heading upwards again. So instead of coming down in a nice smooth line as we did in the first and second waves, it looks like we're heading towards a small second peak. Now that's being driven by the coastal provinces because the initial peak was driven by Gauteng, and cases are expected still to go up quite a bit in KwaZulu-Natal and in the Eastern Cape, though I think the Western Cape will start coming down within the next few days.
How concerned are you about KwaZulu-Natal given the unrest last month where we saw many crowds of people involved in that looting who, of course, were not observing any of the COVID protocols?
I was very deeply concerned about the situation because, all of the conditions were created to spread this virus and creating, ideal super spreading conditions. Large numbers of people, no protection, in unventilated, crowded spaces, and that was just, if you could have bad news in the midst of a wave, that was it. But I think what we also saw is accompanying the looting was almost a self-imposed level 5 lockdown. People were staying at home. So we seem to have slowed the epidemic a little, but also we seem to now be picking up those infections that were initially spread through these super spreading events. So it's a combination of various things that has seen this very unusual V-shaped curve that you see in KwaZulu-Natal. But we can expect that the numbers are going to rise now.
I want to speak to you about the issue of vaccine hesitancy. We have seen a slump in demand for the vaccine at our vaccination sites. It's quite dramatic when you look at the graph. Around the end of July, we were hitting a 7-day average of 218,000 jabs a day. By sort of middle of August, we were down to, I think, 120-odd thousand jabs a day. That's a huge drop, a huge daily drop. We know there was availability issues, but speaking to the Human Sciences Research Council who've surveyed this, they say they don't think the issue is vaccine hesitancy, fake news, etc. They think it's actually more an issue still of access. What do you think is at the heart of it, or do you think there's a culmination of issues?
I don't think it's any one issue. I think we'd like to view it simplistically and say, oh, it's one problem. There are now several studies, starting with the Ipsos international study. There are now 2 HSRC studies. There have been other market studies that have been done. And all of them, vary, but they sort of head towards around 70–75% of South Africans are willing to be vaccinated. There's about 10 to 12% of anti-vax sentiment, which is a bit worrying that it's that high. I would have thought it would be much lower. And then you have those that are in between that are simply hesitant because they're not sure. They're not sure if the vaccine's safe. They need a bit of convincing, but they're not anti-vax, they're just hesitant. So when you take those 3 groups, our focus in the initial part of the vaccination program is on the first 72%, ensuring that we're providing information and demonstrating the success of the vaccination program for those who are hesitant. Now, in any new intervention, you will always have a situation where you get the first group. They are called the early adopters. The early adopters are those, when something new is coming, let's say, a new iPhone. They are there at 2 a.m. in the morning, and they want to get the first They want to wait. And then you get, when you've done with your early adopters, your next group are now not so excited about coming and standing in the morning for their iPhones or for their vaccines. You need to reach out to them. And they need a bit more convincing. They need, services. It needs to basically be less of a challenge for them. They won't be willing to undergo obstacles, take a bus and a train and so on. They want the vaccinations to be more easier.
Prof, it makes a lot of sense. And also, it's difficult for some people to get to these vaccination sites. But also, let's not forget it was cold in the first 2 weeks of August. So I really hope that we're going to see an uptick. But it is crucial that we have to keep on at this issue. I have to ask you about the fourth wave. I saw a tweet where you said the fourth wave is coming on December the 2nd. That's very specific. Tell me more.
Yes, I did a presentation at the eNCA Commission in which I provided just some rough estimates. And I made it very clear that there are so many unknowns in all of these that I'm providing these numbers just so that they can get a sense of when things are likely to happen. And I used that same slide in a lecture I gave to students, and somebody tweeted about it and wrote about it. In essence, when you take the interwave interval between our first and second wave and our second wave and third wave, it's about 99 days. In fact, it's about 94 days in the first interwave interval and 99 days in the second interwave interval. So if that remains the case, and we don't know if it's going to remain the case, but if it remains the case, then we can expect that we would have our fourth wave roughly in the early part of December, say in the first half or first 3 weeks of December. And I used the 2nd of December as a marker to just indicate it was early December. I don't know the exact date. I don't even know, what the fourth wave is going to look like, because it's essentially going to have to be driven by a new variant. And we don't know whether there's a new variant, what it looks like, and how it's going to spread. So there's a lot of unknowns. But based on the history we've seen of the first 18 months of the trajectory in this country, I was just saying that that's a likely scenario, if I had to give you any scenario to help guide your planning for when the next wave is going to occur.
All right. Well, thank you so much, Professor Salim Abdool Karim, talking about the fourth wave. He is, of course, the former chair of the Ministerial Advisory Committee on COVID-19 and the director of CAPRISA, the Centre for the AIDS Programme in South Africa, saying the fourth wave likely coming early December. And, of course, what can we do to help deal with that? We can observe social protocols, COVID protocols, and get our vaccination.